Cancer treatment has changed significantly in the past 10 years. And one of the keys to modern treatment is our ability to find the cancer very early. Patients have greater awareness of cancer now. They go into their doctor and get checked like they're supposed to. Men go and have a PSA blood test to look for prostate cancer, and women do self-breast exams and get mammograms to look for breast cancer. A newer way to treat a lot of cancers is with brachytherapy. And what brachytherapy is putting radiation seeds or sources right inside the cancer area and treating that cancer from the inside out. We don't have to blast the radiation in through these normal tissues to get it in there. We can put the radiation right inside and treat from the inside. And this allows us to give the really high doses that we want with much better protection of those nearby normal tissues. As far as brachytherapy is concerned, a lot of people are familiar with an older version of brachytherapy where small radioactive seeds were put in the prostate permanently. This is called a permanent seed implant. There is now a newer brachytherapy treatment where the radioactive seeds go in but are removed back out once treatment is complete. And a lot of people don't realize that there is this other newer way of doing the brachytherapy. For almost every patient, these temporary implants are preferred over the permanent implants. If we can remove the radiation back out when we're done, the patient's side effects are going to go away very quickly. If we remove the radiation out, the patient's not going to be radioactive at home around his kids and grandkids and anybody pregnant. He doesn't have to worry about being around those people. And the newer temporary implant is a much stronger implant, giving the radiation further outside of the prostate, which can still cure these people with a little bit more risky disease who may have had cancer spread out of the prostate a little bit. If a lady has a small breast cancer, her surgeon will take her to the operating room, remove just the cancer lump. You don't have to have a mastectomy anymore. You can just have that small lump removed if the cancer is small. And then once we have word from the pathologist that everything looks good, that there's no residual cancer left inside or anything like that, and that it really hasn't spread to outside areas, then we place into this cavity where the cancer was a small balloon type device, and a tail of the balloon will poke out of the breast just a little bit, and we can feed in a wire cable that has a radioactive seed on the end. That wire cable goes into the center of the balloon, and that radiation seed will sit inside the balloon for about 10 minutes at a time, giving radiation outwards just a little bit, just enough to kill any little bit of cancer that might have been left behind in that area. A lady would have this balloon device in the breast for 1 week. She would come into the cancer center every day for a treatment. There's a morning treatment and an afternoon treatment, each taking 10 minutes. And then at the end of her 5th day of treatment, we take the balloon out of the breast, put a little Band-Aid on her skin, and she is done with her whole radiation treatment. Well, the things that are exciting about today's cancer treatments are that we can preserve important body parts and normal functions. Women don't have to have mastectomies. They're very pleased afterwards with the shape and feel of the breast. It's really nice to be able to do that for women. And as far as men go with prostate cancer, preserving sexual function, preserving the ability to control your own urine and not have leakage, these are huge advantages to men. And if you can cure the cancer and preserve these normal functions, then that's a home run for everybody. And that's what we can do with modern cancer treatment.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.